What I love about being a physical therapist is seeing the rewards. It's a very, very rewarding job as far as patient care goes. It's great to see a patient come into the clinic from their initial evaluation and you take them through their whole course of rehab and to see how they've progressed in that time and how they've changed functionally from start to end. Very, very rewarding. I love being around people all day, the interaction. It's fun in the clinic, not only interacting with my coworkers, but also interacting with all of the patients. And it's fun to see the patients interacting with each other as well.
I just love the daily interactions and how often we get to see and follow up with our patients. You get to see such progress that way, and the continuance of care is wonderful in that aspect. You really get to see patients return to their lifestyles and reach goals that they're hoping to achieve through their rehab process, which is really rewarding.
I love my job because I get to work with a lot of different people, very interesting people, and do my best to help get them better. Dr. Gruber is probably the best surgeon that I've ever had a chance to work with, and I've worked with a lot of surgeons. As far as the team goes, we have an outstanding team of professionals on this side. Holly, she's the director. Jessica Tate, who's a new physical therapist we brought in. They're both very educated, very in touch with their patients, and they're really compassionate about what they do. So we all work as closely together as we can, and continue to grow as a team.
I think everyone really collaborates well. So everyone that works either in the physical therapy or the physician's office side, we're handpicked by Dr. Gruber. So he saw something special in each one of us, and that kind of brought everyone together. So, you know, each person, they do their jobs very well, but everyone is also able to kind of interact with one another. So if we need help with something, picking up slack in certain areas, you know, we work very well with one another. So I think, you know, from that perspective, that it's very tight-knit here.
Our model differs with other clinics in the fact that we work so closely with our surgeon and our PA, Rob Hutchinson. We're right down the hall, so we constantly maintain communication concerning patients. We meet on a weekly basis for an in-depth meeting discussing each patient individually, their progress, their needs, where they are in their therapy program.
To me, I just think it's wonderful because you keep everything within the practice. It's so important to see your patients through from start to finish, and a lot of times what ends up happening is patients will tend to slip through the cracks. With our model, you know, before we even see them in physical therapy, we've already had a discussion with Dr. Gruber or with Rob regarding their case. We meet once a week with Rob and Dr. Gruber. We discuss all active patients that we have on the schedule, and then any upcoming patients that we might have that week. Those upcoming patients, we talk about whether, you know, what their diagnosis is, whether they had a surgery, whether it's just, you know, a patient with knee pain. We go over their imaging, any concerns, any precautions. And so before we've even evaluated them, we're so much more ahead of the game in knowing what's going on with their case. And it's really neat when the patients come in and, you know, some of them will say, how did you already know that? And how do you know all this about me? And we say, well, you know, we meet once a week and we've discussed this with Dr. Gruber and Rob already. And, you know, we want to be prepared for your rehab and be able to prepare you the best. So it's a great model, and patients love it. They like knowing that they can relay a message to us and say, hey, can you let them know tonight in the meeting that this is still bothering me, or I'm feeling better about this. And it's great. We can just go to them and discuss their case and move on from there.
Being able to collaborate as we are, I think that provides the best patient care possible.